everyone, my name is Jaclyn Tomasetti. I'm the licensed clinical social worker here at United Medical ACO. We're going to be talking today about why social work is important within the ACO. So social work is extremely important within the ACO because it incorporates behavioral health as well as the medical aspect within the ACO. So medical diagnoses and behavioral health diagnoses actually go hand in hand. It goes hand in hand because the primary care doctor and behavioral health, like myself, work hand in hand to make sure you, the patient, are getting exactly what you need. So we make sure that we work together every single day to make sure that you are getting what you need on the everyday basis. So in working with our primary care physicians, they help identify patients who may need behavioral health services. So they may be feeling depressed, they may be feeling anxious, and when they identify those needs, they refer them to myself as well as our behavioral health coordinator, Stephanie, and we work together to help those needs, and we refer them to outside organizations such as outpatient facilities, maybe partial organizations or inpatient facilities if the need is that great. Once we got patients into services and we were able to see what they needed, we were able to follow the patient through services, and we were able to make sure that they were getting exactly what they needed. We've been able to follow the patient to make sure that they were able to go to their appointment, and we've actually been able to follow them and make sure they were able to get to their appointment on the day that they were scheduled, as well as during their 90-day follow-up, as well as their 180-day follow-up. So we were actually able to follow the patient all the way through the levels of care. So when the first day that the patient was identified with their PCP, all the way through to 180 days. When the patient was first identified, we were able to see that they had a high level of anxiety and depression, and then we were able to get them into services, and we were able to assist them. So now their anxiety and depression are lower than what we had originally anticipated. So our program is able to assist them getting them into services and getting their depression and anxiety a lot lower than when they first entered the program. Here at United Medical, we're also part of the START initiative with DSAM. We are also using the D-Trans system. So when we also have patients who have substance abuse issues as well as behavioral health, we are also using the D-Trans system to get patients into services quicker. So we're able to have them in the PCP office, and they're able to leave with an appointment that day. Due to being part of the START initiative here at United Medical, it actually gives us an advantage to be able to help patients get into services a lot quicker, so that we're able to have patients get into treatment and have access to services sooner, so that they're able to be in treatment as soon as possible, which is exactly what we want here at United Medical for you. We're able also to identify patients who are at risk by using our electronic medical record at United Medical. We're able to identify the utilization of services that they have, and we're able to get them into services that way as well. So our day-to-day activities include, Stephanie and I talking with patients who may be at risk of feeling depressed, anxious. They may have substance abuse issues as well. So we talk to them and we get to know them. We get to know exactly how they're feeling, and we get to know what services they may want to do. When we talk to you, we want to know exactly what services you'd be interested in, whether it's individual therapy, group therapy, family therapy. You may even want to do therapy with your spouse. So we talk to you and get to know a little bit about what it is that you want to do. You may even want to be in a partial program, so we may refer you to that type of service. If the services are greater in need, where you may feel at risk, then we may refer you to a rehab service, or we may refer you to an inpatient service. So our day-to-day is very different depending on what's going on. We may even have a primary care physician knock on our door and say, we have a patient who'd like to talk to you in the office, because it may just be that great of a feeling for that type of patient. So, myself or Stephanie will walk down the hall and talk to that patient in the office and see what's going on. So, the day-to-day activities that we do here at the behavioral health program vary, depending on what is going on. Although the ACO is statewide, the Behavioral Health Department does support the entire ACO. So even if you are down in the Seaford location or down in Dover or even up in Wilmington, we do still take those phone calls, and we do assist patients and we do assist doctors in crisis management, as well as felicitating outpatient resources. So we will assist with mobile crisis. We will assist people getting into outpatient services, as well as getting them into inpatient and rehab services if the need is there. So we are still available to assist with any type of resources that are needed throughout the entire ACO. Even though we are located in the central office, we are here to assist with needs throughout the entire ACO and fit whatever needs you are looking for. We here at United Medical understand that there are barriers to treatment, and we want to see you achieve your treatment. So we want to be able to get you into the proper treatment that you see fit for yourself. We want to be able to help you see someone that's relatable to you as a therapist. We want to be able to help you get into treatment that you find that's best fit for you. If you find that you're not able to find the right resources, then we're here to help you find them. If you're a patient at United Medical ACO, please contact your specialist or your primary care doctor to get more information on how to be referred to the behavioral health program here, so that we can further assist you into getting into treatment. Hope to hear from you soon.